5:30, local doctors are pushing for pregnant women to get vaccinated as we learn more about the dangerous complications that can come from getting COVID. A study looking at health data found pregnant women who had not been vaccinated against COVID and caught the disease were much more likely to suffer severe complications for themselves and for their infants than those who had been vaccinated and got COVID. There is also growing evidence that vaccination rates among pregnant women remain much lower compared to the general population. Joining us now is Dr. Zeher Merihi. I hope I'm pronouncing that correct. He is an OBGYN and the founder of the Rejuvenating Fertility Center in Westport. Doctor, thank you so much for being with us.
You're welcome. Thank you for having me.
So we just kind of broke that down, that there are less women who are pregnant getting vaccinated. First off, why do you think that is?
It's a fear, that's really started, from someone who not sure how scared people from the vaccine, showing that, oh, this could, kill your baby or causes congenital malformations, and that's why it's not just during pregnancy. There's a lot of people who are not trying to get pregnant who are still scared of vaccine. But I really think there's a lot of anxiety for some unknown reasons toward this vaccine, and especially during pregnancy, and that's why more pregnant women are less likely to take the vaccine compared to non-pregnant women.
We also mentioned the fact that the pregnant women who do not get vaccinated and then get COVID often face worse outcomes. What complications or risks do these women face from COVID?
So there's a tons of studies showing that women who get COVID during pregnancy are more predisposed to perinatal, meaning complications with the pregnancy itself, with the baby, preterm birth, and even miscarriages, right? None of the studies that looked at the vaccine and those outcomes showed any statistical significance. So the vaccine seems to be extremely safe during the pregnancy as of the data so far. So that's why we definitely recommend patients, whether they're pregnant or not, to take the vaccine, because really the complications from the virus itself are way much more severe than the vaccine itself.
And how can it affect the baby also while in the womb or after having just been born? How do those adverse effects play out?
So the adverse effect of the infection itself, because the infection induces a very strong immune inflammation throughout the body, this is how it can cause miscarriage and preterm birth. So, preterm birth by itself, when a baby comes earlier, there's a lot of complications that are related to the neurological function, the breathing, the GI system. So all those are increased if someone gets COVID, especially in the third trimester, which is close to giving birth.
And so bottom line, for women who are of the age where they could get pregnant and are interested in getting pregnant, are there any risks from the COVID vaccine for them or their babies?
The answer is no. As a fertility specialist, I tell my patients to take the vaccine before they even attempting to get pregnant, because getting COVID during pregnancy can cause problems for their health and their baby's health. And the sooner they take the vaccine, the better it is. And also for women who are trying to get pregnant, there is zero data showing that the vaccine itself causes any complications getting pregnant. Now, there is one recent study showing that the vaccine itself could cause irregular menstrual cycles in a lot of women, which is transitional and get resolved on its own. So there is no permanent effect on reproduction per se. But also, I always tell patients, there's a lot of vaccines out there that causes the irregular menstrual cycles. So we just don't want to say, COVID is bad, because it's not the only one that causes these temporary changes in the menstrual cycle.
All right, well, that makes a lot of sense. We appreciate all the good information you gave us tackling this topic. Dr. Merihi, thank you so much for being with us.